Yay Networks.
Welcome to the Great Girlfriends podcast, where we discuss life, love, laughter, and everything in between. I'm your host, Sibylla Muti, and I can't wait for you to hear all of the Great Girlfriend magic on today's show. So without further ado, grab something great to drink, grab your pen and your paper, and get ready for this week's episode. Enjoy!
Happy Wednesday, Great Girlfriends. I am so over the moon excited to be with you today and to have a couple of guest Great Girlfriends who are here to join us and kick off a conversation around cancer, specifically endometrial cancer and the effects that it has had on women of color. I love that we can share like this intimate podcast space and we get to dive into these very deep, penetrating conversations and know that we have people who are advocating and serving as allies in the health industry to support us. So first, I want to thank our partners, Healthy Women, for being the ones to kind of really kick off this conversation and ensure that we're able to have what we need to curate expertise and have also survivors that are here to share with us. And I also want to thank our partners from Eisai for providing funding and resources that will help sustain conversation and also support for people who are in need on their journeys. So today, I want to talk to Dr. Shawana Moore and Stacey Powell, who is our survivor here today. Welcome, Great Girlfriends. I am so happy to have you both here. Listen, after going through our little sound check and having our little East Coast powwow and recognizing that there was so much in common, we're also sitting here as women of color. We're sitting here as great girlfriends. I really want to talk to you both about, one, how you're doing today. That's first. And two, I want our great girlfriends to learn more about who you are. So how are you feeling, Stacey? How are you today?
I'm doing really well today. A little nervous. I start radiation tomorrow.
No, okay.
Yeah, so I'm a little nervous, but I'm feeling pretty good about it, knowing that I'm like halfway through my journey.
Yes. Oh my goodness. Okay. Well, I hope today will like cheer you forward and make you feel ready. And, let you know you're fully supported on your journey.
I appreciate that. Thank you.
Yes. Thank you, Stacey. Shawana, how are you today?
So I'm doing pretty good. I am just thankful to be among a survivor that's willing to share her story while going through it presently. I think that takes bravery and courage. So I'm honored to be here and share this platform with Stacey and hopefully help amplify voices of other women of color that may suffer from endometrial cancer as well as other uterine cancers.
Mm-hmm. Okay, so tell us a little bit about who you are, Dr. Moore, and also tell us, what makes this topic so important or a passion point for you?
Absolutely. So I am by training a women's health nurse practitioner. I've been in practice for going on 11 years now. Majority of my clinical experience has been in the Philadelphia, New Jersey area, where I really focus on caring for disproportionately impacted communities of people. I was born in a city called Camden, New Jersey, where my parents currently reside. So it's a high incidence of lots of inequities, lots of health conditions that go untreated or not properly treated. So I've really tried to dedicate my life to really focusing on communities of people that have been disproportionately impacted of no fault of their own. So I recently moved to Atlanta, Georgia, where I have a faculty appointment at Emory University. I serve as their director of the Doctor of Nursing Practice program, where I help support and generate the next generation of advanced practice providers that will hopefully go out there to impact and transform healthcare. And my hope is that it's done through a lens of equity so that we can really help dismantle the inequities that certain populations of people experience. Prior to assuming this academic appointment, I was the previous director of the Women's Health Gender-Related Nurse Practitioner Program at Thomas Jefferson University in Philadelphia for about 9 years. So I still practice here in Atlanta. I serve as a volunteer nurse practitioner for Center for Black Women's Wellness, and I also have a clinical appointment within a private practice that I'm at once a week.
Okay, so Dr. Moore.
Yes.
Stacey and I are both trying to figure out how you did all this at 21. And
yes, thank you. Yes, absolutely.
And what and how and when do you find time to sleep? This conversation has totally. I'm looking at you like, but how? She looks 21 and she's rested. I can tell she's getting rest. So how is she doing all of this?
So I'll say by the grace of God, and I'll say it's because of the community that I came from that drives me. I feel like I was given gifts, right? And these gifts should go back into communities that are really impacted through no fault of their own. I always say is rooted in a lot of structural racism that brown and black communities experience, inequity specifically around health. So I feel like it's my job to serve those communities and help amplify those voices through the talents that I was given. So I try to make sure I use my gifts to do good by the communities that I came from, because my family are still there, right? And there'll be generations of people that'll still be there. So how do I make sure when I leave this earth, I left it better for them?
Oh, I love that so much. Thank you for sharing. Thank you so much. Okay, Stacey Survivor, you're literally lighting up TikTok. I was going through your TikTok and watching videos, and I feel so very inspired by you because I know that you're in the middle of your treatment journey, and I also know that you're here to advocate on behalf of other women who are the same. I would love if you could share a little background on your story of learning the first diagnosis and all the things that have led you to this conversation today.
Well, first and foremost, I had never heard of endometrial cancer. Had no idea. So I noticed after complete menopause, and they told me I had my hormones tested. They said, you're done. I started to spot, and I was like, well, maybe this is, part of menopause. And I kind of ignored it. And I didn't call the doctor because, of course, there's this COVID. And I am one to go to the doctor for anything. And I was just like, I don't feel safe. I don't want to go. COVID kind of really put me down. And I didn't make any appointments. And finally, I said, this is ridiculous. This is going on too much. This should not be happening. And I called the gynecologist, and it sounded really hopeful at first. And she goes, well, we're going to do a DNC, we'll get this taken care of. And I was like, okay, fine. And I wasn't thinking cancer or anything like that. And I know I had an ultrasound, and I heard them whispering in the corner. I said, that's not good, whispering in the corner. And I heard, just little, and I was like, okay. So they decided to do the DNC, and my doctor called and said that they found cancer cells in a uterine lining. And I was like, oh, okay. And just shocked, like, what am I hearing? And she was like, it's called endometrial cancer. And I said, I've never heard of that before. And so she explained a little bit, but then she was like, I need for you to call. And she went with the quickness to have me call Asplund Cancer Center in Willow Grove, Pennsylvania. And she was like, this is the best doctor. I want you to call immediately. So I called and I couldn't get the head doctor. And they said, we have wonderful doctors. We need to get you in immediately. We have the results. We have your ultrasound. We have everything from pathology. Can you come within like days? They made an appointment for me. And I met this wonderful oncologist by the name of Elizabeth Burton. And she sat with me for 2.5 hours. I had my sister on FaceTime. My partner was in the room with me. She drew pictures. The nurse was in the room. They explained everything that was going on. At that time, it seemed that they would be able to give me a hysterectomy robotically, and I would be in the hospital a couple of days. I'll be back at work, within 4 weeks. And I'm thinking, okay, this is a simple thing. And she goes, well, I want to do some testing first. And I didn't really understand the stages and everything. I thought staging was the same as there's types and there's staging. And she was like,
Mm-hmm.
oh,
That's
you
great.
know, and I just didn't understand what was going on. And I wrote everything down. And my sister, thank goodness, asked all the questions because I was a little confused. But, you know, I was like, well, what does this mean? And she goes, well, this means you need to go for some further testing. And when I went for further testing, I had a CT scan. She called me back in and she goes, the cancer has spread to some lymph nodes. So we're going to have to do a traditional hysterectomy. And at that point, I felt so comfortable with her. And I was like, do what you have to do to get this cancer out of me. And that began my journey.
Wow. And so here we are now. Where are you now in your journey? I know tomorrow we begin radiation.
Yes. So I had the hysterectomy in March, complete hysterectomy. They removed 2 lymph nodes. So I was classified as stage 3 C2. And I was like, that doesn't sound so great. Because, you know, you hear stage 4 and you think terminal. So I was like, you know what? I need to change my mindset. This is not going to beat me. All right, stage 3. She said she got everything out of the uterus. She took 2 lymph nodes out. She had prepared me that I may have to do chemo. And that's the one thing I did not want to do. But she prepared me. So I said, okay, so we're going to have to do chemotherapy. All right, and I'm going to get through this. So after I healed up from the hysterectomy, we started preparing for chemotherapy. I was going to do 6 rounds of chemotherapy every 3 weeks. They made more appointments. I had a port put in, and I was on the go. And I was terrified deep inside, but I prayed and I talked to my sister, who's been my support, and my daughter. And she was like, you got this. You got this. And so then I received a phone call from one of the nurse navigators at the cancer center. And she went through everything with me. It was a 2.5-hour call. And then she asked me, what are you fearful of? Tell me. And I said, well, you know, the horror stories of chemo, the nausea, the vomiting, the losing of the weight, all of that. She goes, well, I can reassure you that we have medicines now that will help with the nausea and the vomiting. I said, that's the one thing I'm afraid of. I can't stand being nauseous. I can't stand vomiting. She was like, we have you. We have your back. Don't you worry.
Yeah.
And when I tell you, this team made me feel like I was the only cancer patient there. After the first visit, after the first treatment, I was like, I got this. I got this.
Yeah.
You know, and so the one thing that I did do is I made sure I kept a positive attitude. That's so very important. You know, I didn't wallow in, whoa, why me, Lord? Why me? Why do I have cancer? Why do I have this kind of cancer? You know, and I don't have any history of cancer in my family besides my father, who was 80 something. He had colon cancer. But the women didn't have cancer in my family. And I'm like, where did this come from? And I was like, you got to throw that all away. You're going to get through this. So really a positive attitude helped me through it. My sister and I laughed a lot during chemo, the 6 rounds. The nurses would come in and laugh with us. We joked and told stories. And of course, the medicine would knock me out. And my sister would take videos and pictures of me being passed out and show me when I woke up, and we would laugh. And I just truly believe having a positive attitude, getting rid of toxic people in your life really made a difference with me getting through those 6 rounds of chemotherapy.
Wow.
Great girlfriends, as you know, I was so excited about 7 years ago to turn what was a super passion into a very powerful community and brand called the Great Girlfriends. I am so excited because I use tools like Skillshare to help me level up on things that I had no knowledge about, like social media, business development, entrepreneurship. And now it's safe to say I feel confident in the work that I do every single week on this podcast and the team that I've built around the show and the community. And I am so privileged to get to share Skillshare with you. My personal experience with Skillshare has been wonderful because I don't have to feel like a novice at things for long. Skillshare gives me the space to really learn new tools, give me the skills that I need to level up on my experience to make me more confident in social media and in business, and also gives me the space to learn even more to ensure that my community is always as powerful as I can make it. So I'm super excited because Skillshare is now available to all of you. I love that the classes are curated and polished for maximum impact. In under 60 minutes, you can learn more than you would in a whole weekend spent all over YouTube. With Skillshare's project-based, community-driven format, you'll start applying those lessons ASAP, and you'll get feedback as you go along, which is so important. And one affordable yearly membership fee unlocks unlimited access to all the classes you want to take and more. And you can keep learning on the go with the Skillshare app, which I absolutely love. You even get to level up your e-commerce chops, branding skills, social media savvy, and more with new classes launched every single week. My personal favorite class right now is Finding Fulfillment Using Pivots to Power Your Creative Career by Emma Gannon. I absolutely love all of the tools and resources and expertise that Emma offers in this class, and I really hope you'll join that class as well. So, I want you to do what I did. Turn your passion into a payday and do it with Skillshare. Visit Skillshare.com/girlfriends today and get your first month free. That's Skillshare.com/girlfriends.
I want to walk back a bit. Thank you so much for sharing, Stacey. I cannot imagine, because you go from a regular day to, hey, you have this diagnosis and you don't even know what it is. And there aren't enough Google searches in the world to help you get a full understanding of what that is. What exactly is endometrial cancer, and how many women, what do you know from the data in terms of women who, like Stacey, don't have a history of it in her family, a known history of this, and are hit with this diagnosis? How many women of color are facing this? What can you share with us, Dr. Moore?
Absolutely. So thank you, Stacey, for sharing your story. It's a quite compelling story. And unfortunately, this happens to a lot of women. I would say, based on the data, uterine cancer is the fourth most common cancer among women in the United States. So uterine cancer is cancer of the uterus. Of those types of uterine cancer, endometrial cancer, which is the lining. I always tell women it's the lining that you usually shed each month. So when you came in and you had what we call post-menopause bleeding, that's considered abnormal because your lining should be so thin that nothing should be shedding anymore. And because your ovaries aren't as functioning as they would normally do, right? So when you had that bleeding, that's a key alarming sign that you may have a possibility of having uterine cancer, specifically endometrial cancer. So endometrial cancer is a form of uterine cancer that impacts our endometrial lining, which is typically the lining that we would shed each month. In terms of the amount of women that are impacted, within the United States, close to a little over 65,000 women are diagnosed with endometrial cancer. When we think about it from a race and ethnicity perspective, we know that Black women, when compared to white women, have a higher incidence of diagnosis of endometrial cancer. Also, Black women are more likely to die from the disease. We know that various factors may play into that. One of the key factors is a late diagnosis. So sometimes the good thing about you, Stacey, is that when you saw the bleeding, you went in to seek care. That doesn't always happen. So I think the biggest thing is making sure, regardless of a person's race or ethnicity, that they understand the importance of, we call it our annual exam or a well person exam or a well woman exam, that we should continuously get, regardless if we are having a period or not. Every year we should see our healthcare provider, and one of the key questions we ask individuals are you menstruating? If you are still menstruating, when was the last menstruation? How long did it last? What was the flow of it, right? So if you have a patient who came in who was postmenopausal and they didn't have a period for over a year or 2 years, and then they all of a sudden say, well, I bled a little bit 6 months ago, but it was a little bit amount, so I didn't think much of it. You're able to catch it at that visit when they come in for their yearly checkup, because they didn't come in just for that bleeding when it happened 6 months ago. But that sets up a switch in our head as healthcare providers and say, hey, we need to do a workup for postmenopausal bleeding, which includes either an endometrial biopsy. It sounds like you had the DNC, which is appropriate as well. Typically, ultrasound is included, so we can evaluate that uterine lining and your pelvic organs to see what is going on and causing that bleeding to occur, because it should not occur after you have 1 full year without having menstruation. The other thing about the data in terms of statistics.
That's very big, Dr. Moore. I don't know if women know that. So you're saying after you have not had a full year of menstruation, you should not resume bleeding.
You should never have any bleeding again.
Okay.
Yeah, and I think that's the thing. Women say, oh, it was just a small amount. So usually it doesn't bother them. They'll say, well, it was painless, nothing occurred. It only happened a little bit. So they won't pay it any mind and they won't come in for that. But as a healthcare provider, when they come in for their annual exam, we're able to ask those questions, and that information is sometimes obtained, and it allows us to do that workup to make sure everything is okay with the endometrial lining.
Okay, that's really good. Yeah,
that's really important. And I think even from a healthcare perspective is that we normalize the conversation so patients do know. So I use it as an educational opportunity every year when I see a patient for their annual. If you haven't had a period in a full year, and if you have any bleeding, you come back to see me or another healthcare provider as soon as that happens. So I think it's an area of opportunity. So even if they come in and they haven't had bleeding, it's still a teaching point. So it's always important. Sometimes women equate not having to have a Pap Smear as I don't need to go for my GYN exam, but you still need an annual GY exam. It's just the Pap Smear may not be collected for screening for cervical cancer based on your age, but we still do a pelvic exam to evaluate your pelvic organs.
wow.
Yeah, we still need to do that, and we still need to take a thorough history to determine is everything progressing in an appropriate way that it should be progressing.
Great girlfriends, I know you're out there looking for great talent, and during the pandemic, that became incredibly hard. However, I can safely say that things will get better for you as they did for me using LinkedIn Jobs. I love that LinkedIn Jobs is here to make it easier to find the people that you want to talk to, hire faster and for free. What's super cool is that you get to pull from a pool of talent from around the world. You get to curate and customize the things that you want to have in the profile that you're looking for. And LinkedIn Jobs is going to make available many qualified, talented people that you get to choose from and hire and use at your leisure. Create a free job post in minutes on LinkedIn Jobs to reach your network and beyond to the world's largest professional network of over 810 million people. And I did say a free job post, and it literally takes minutes. Then the next thing you do is add your job and the purple hashtag hiring frame to your LinkedIn profile. That gets the word spread around that you're hiring so your network can help you find the right talent. So amazing, because the more people that are helping you, the more likely you are to get the most qualified, talented pool available for your company and for your teams. Then they have simple tools like screening questions to make it easy to focus on candidates with just the right skills and experiences, so you can quickly prioritize who you'd like to hire an interview and who you'd not like to hire an interview. So this is why I personally and many more small businesses would rank LinkedIn Jobs as #1 in getting us quality hires versus leading competitors. LinkedIn Jobs helps you find the candidates you want to talk to faster. Did you know every week nearly 40 million job seekers visit LinkedIn? Post your job for free at linkedin.com/greatgirlfriends. That's linkedin.com/greatgirlfriends to post your job for free. Terms and conditions apply.
Okay, so what's interesting about that? You just said that you don't necessarily need a Pap smear, right? Because I think what is the rate? What is the year now? It's every how many years?
So great question. It's a little bit complex, but I'll give you the simple term. So there are
Okay.
different guidelines, but it's based on age. So it can be anywhere from every 3 years to every 5 years, depending on your age and depending on if we do cytology, meaning we check your cells alone, or if we do something called cytology with co-testing for HPV, where we check the cytology and then we check for the presence of HPV or the human papillomavirus virus. So
Okay.
anywhere between 3 years to 5 years, but then that could fluctuate if a patient had a history of certain procedures on their cervix to help prevent the development of cervical cancer. But typically between every 3 to 5 years, but depending on age.
However, we should have gynecological exams annually.
Every year, yes. And I think
Mm.
historically we have not done the best job from a healthcare perspective in terms of educating individuals to understand the difference, right?
I'm gonna agree with you.
Yes, yes, I agree 100%.
Today years old when I
Mhm.
found out the difference between the two. I've had exams annually, not knowing that that there was a difference between. So this is like, you see my eyes, like, what do you
Yeah.
tell me more? What are we talking about here? This is so good.
Yeah, so and that's the other thing I'm like is we haven't done a good job of educating our patients, right? So a lot of patients have this misconception that the PAP was the annual, but I teach patients like, no, that can be a part of your annual exam, but it's not the annual. The annual exam includes your thorough history, it includes a full head to toe assessment, and that pelvic exam. Even if we don't take that collection of your cervical cells, we still want to do that pelvic exam to make sure everything's okay in terms of your uterus as well as your ovaries, fallopian tubes. And we still want to do the speculum exam to take a look at the cervix if it's still present, the vaginal tissues, and take a look externally at the external genitalia as well.
Okay. Okay. So you also mentioned in there that women of color are dying from endometrial cancer at a higher rate than non-minority women. Can you just touch base on what you think is the cause of is it the equity part? Because you also mentioned equity, and it's such a major word for us to even dive into. What do you think is contributing to that death rate for us?
So yes, I do think equity has a lot to do with it. I think it's years and years of systemic racism that plays a lot into the healthcare that Black and Brown communities, health conditions in healthcare that Black and Brown communities experience, whether that be endometrial cancer or asthma or diabetes, right? I think it is rooted in that. So that's one of my biggest goals. I'm just like, if we can change the world where equity is at the forefront of everything we do, that will have a huge impact and change in so many areas. There's such a huge importance of it. So I would say that's the root of it, right? I think that's the root of a lot of health conditions. And I think endometrial cancer falls right in that same line as well, right? Based on the data, we know that age plays a factor, right? It's not that Black women age faster than white women, but there's this thing called tithering, right? Or weathering, I should say, where years and years of constant exposure to inequities, to racism takes a toll on us physically. There's physiological symptoms that are associated with weathering, right? So I'm like, that has an impact on our health. But with uterine cancer in general, as we women get, I always say wiser. I never call my patients older. I say you're wiser in age.
Yeah.
Another positive, right? So it's more common after age 50. We also know that obesity or individuals who have obesity as a condition have a higher incidence of endometrial cancer. And I bring that back because there's a high incidence of obesity within the Black and Brown community. But I link that back to systemic racism and inequities, right? I'm like, that's rooted in that as well. So
access
I'm like,
to food deserts, these things, the types of foods.
Exactly. I'm like, all those things play on each other, right? So some people may say, oh, no, it's just health. They're not healthy. I'm like, no, there are social factors, right? Those are economic factors. There are structures that have been put in place that cause a specific group of people to experience these health conditions, right? Genetics plays a factor, right? But can range, and it's not that African American people have a higher incidence of genetics related to endometrial cancer. Type 2 diabetes, which is very prevalent within the Black community, right? Plays a risk is a risk factor for endometrial cancer development. We know diet and exercise plays a factor, but again, I think it's multifaceted. And I always say I bring it back to equity, because I'm just like, these systems have been put in place, right? And historically, they place our health at a disadvantage, right? Even when it comes to seeking health care, right? I know personal stories from patients that come to see me, and they're so thrilled that someone that looks like them is in front of them, because they feel like what they're saying is going to be heard in a different way and received, and action will be taken. Whereas that if people had negative experiences with healthcare in the past, they may not come if they have bleeding, because they'll say, well, I had this happen before when I was trying to start on maybe birth control, or I was just trying to get tested for a sexually transmitted infection, and I felt judged, I felt uncomfortable, I felt like I wasn't valued or heard. So I don't think I'm going to go back. I'll just see if it goes away, right? And that can be a delay of care. So I think even I hate to say mistrust, I say broken trust in the medical system when it comes to Black and brown communities seeking healthcare. So I think it's multifaceted.
It is.
Great girlfriends, if you're like me, your head is probably on a swivel from all of the activities that make this season incredibly busy, like back to school, back to work, no more summer Fridays, in-person meetings, and including my son's football season. Time in the kitchen has been cut in half, and I absolutely have found myself in the drive-thru more than I wanted to. However, help is on the way, and help is now here for you, because Splendid Spoon has given me and can give you the fuel you need to tackle everything on your plate with plant-based, ready-to-eat meals delivered right to your door. And when I say right to your door, I mean my doorbell could ring any minute now. What makes me so excited about Splendid Spoon is I'm new to plant-based eating, so I want meals that actually taste delicious and do not remind me that I'm eating vegetables. I love that it saves me time during busy weeks, and it also gives my kids healthy, amazing plant-based alternatives that they can run to without having to worry about them eating things that are junky and not good for their health. So, my favorite meal, the brown rice taco grain bowl, is becoming a go-to in my house, not just for me, for my kids, and perhaps you'd like one as well. I love that the taste is not compromised. I gotta say that 3 times. The taste is not compromised. And Splendid Spoon takes the work out of eating healthy. You get to choose from over 50 ready-to-eat meals shipped right to your door on repeat. From breakfast smoothies and lunch bowls to noodle dinners and light soups for reset days. They make it so easy, great girlfriends. They make it easy, they make it healthy, they make it fresh, and the taste is not compromised. Fuel up for busy days with Splendid Spoon. Get started today and get $120 off of your first 3 boxes at splendidspoon.com/girlfriends. That's $120 off at splendidspoon.com/girlfriends.
Stacey, as a patient, what has been your experience with having access? Do you feel like you've had an advantage or disadvantage when it comes to equity and access in healthcare?
I think I've had an advantage, and I'll tell you why. One, my educational level. I'm a teacher. I have great health insurance as a teacher. And I talked to my sister and we sat down and we talked about this because we know that it is true. We talked to our other girlfriends and things like that. And she even said to me, she goes, you have an advantage. She goes, we have an advantage as light-skinned Black women. And I said, I never even thought about that. She was like, oh, yeah. She was like, you notice that we're treated different sometimes because we are light-skinned Black women. And I was like, wow, I never thought about it. But, as I got my diagnosis and I talked to my girlfriends about it and I explained to them, I'm going to have a hysterectomy. I remember one of my girlfriends, she was like, no, That's the first thing what they want to do to us Black women. They want to take our uterus. No, you need to go and get the second and third opinion. So this has been, already put in her mind
Yeah,
that when it comes to Black women, that's the first thing they're going to do
that's
is
right.
take away our uterus. And I had to sit and I talk with her and say, I don't have time for all of that. I said, I am advanced. I waited too long. I waited too long to go to the doctors for me to have a second and third opinion. I need to get this cancer out of me. I mean, I understood where she was coming from, definitely understood. And, so I really had to sit down with her and say, this is for my survival right now. I've been fortunate. I have been fortunate, and I know that. I realize that. I mean, even through when I was younger, through my pregnancy, I was treated very well. But I have friends that were not. I
Or
had.
family that, yeah, may not have the same access. Yeah, for sure. The stories are so varied, and it's very interesting because education seems to be a bridge builder for most communities, but especially for us, we begin to learn. The more college educated we are, the more we learn from, about childhood history, that you learn that, oh my goodness, other people didn't go through this, or other people didn't have this, because you grow up where you grow up doing what you do. And it's not until you really hit university level where socioeconomic, bridges are sort of created, and you start to meet people from around the world and different cultures, different, different classes, and you understand that there are differences. So the more conversations we have and become connected as women of color, our stories may be very different depending on where we're from and the zip code and and the histories of our families. But education really is a bridge for us to know more about one another and see the world differently, because now those students that you're educating may, their moms or families may not have resources, or may have resources depending on where you live. And it's very interesting that the more we learn, the more we get to baton forward for people, future generations, to know more, to do better, to ask more questions. We get to toss more questions into the toolkit for people to ask. The more bridges we have, it's systemically communication has been cut for us. They don't, honestly, they don't want us talking because they don't want us to know too much, because the more we know, the more advantages we'll seek, right? And so now knowing that, we've done a really great job, I think, as a community to begin talking about more things. But I'd love to know how I guess, can you get ahead of a system? I don't know, but my question is, Shawana, Dr. Moore, how do we get ahead of the systemic, roadblocks that have been there? And I don't know that they'll ever go away completely. How do we get ahead of that so that, generationally speaking, our greats won't have to have this conversation? Maybe it will be something different, but that will pave a better way for them.
Absolutely. I think that's a really great question. And I think crucial conversations that we're having today is key to that. So I think having discussions, not having things be silent, because I think for many years people don't share the stories, right? So it's about sharing the stories and putting into action. How can you make this better? How can we change that, right? So I think having conversations like this, collaborating with organizations that highlight and amplify these stories, and not just tell the story for the story's sake, but really put a plan behind it. That can be the development of an endometrial toolkit, right? I've been working with an organization where we're focused on creating an advocacy toolkit, focusing on a lens of equity. So how we can train and teach healthcare providers when they are assessing individuals for endometriosis as well as uterine fibroids. So I think it's elevating and amplifying stories and I always say, put dollars behind it. So put interventions behind it that may cost money, right? Bring them back to the community. But the key to that is having community involvement. I've engaged with a lot of research projects throughout my time, right? Throughout my short time, right? Because I'm still 21.
That's right. That's right.
But you have to bring those community partners within the research that you're doing, right? Because this is what they live every day, right? I can't come in with what I think is a brilliant solution without being a part of that community or having that community at the forefront. So I think it's communication. I think it's engaging the community to be involved in community solutions that are sustainable, right? Making sure we hold healthcare providers and healthcare organizations accountable, right? To understand this information, to understand populations, to understand how to appropriately care for them, and not only care for them, but communicate with them and validate what they're saying and take action upon it, right? It's different. Like, people can hear you, but if you're not listening and then putting action towards it, it's just you just listened and nothing happened. So
That's so true.
yeah, so I think it's multi-layered, but I always say you need to involve the community. You need to come up with sustainable solutions. You need to ensure you're amplifying those voices, and you need to make sure you're having those crucial, critical conversations to really bring more awareness to the disparities and inequities that are experienced among Black and Brown communities.
So, Stacey, you have taken your voice, your story, and your activism to TikTok. And yeah, you have. And I want to applaud you because, like you said, being in the journey and you're starting radiation tomorrow. So you're in the middle of breaking ground on this and really getting to the other side. How have you seen results from even going on to TikTok, being in digital space and, just really sharing your story? What have you seen, as fruit from that?
It's been amazing. The people that have responded to me, and I said when I started this, and I talked to my daughter, I said, listen, I want to journal this journey that I'm getting ready to go on. I don't know how, I don't know where. She said, well, let's try TikTok. I didn't know how to do TikTok. So, I mean, I just tried it out, and I said, somebody needs to know about this cancer. I knew nothing about this cancer. I didn't even know I was at risk for this. And I said, if I can help two people, I feel that I've accomplished something. So I started doing a little research, and I'm like, oh my goodness, I have all the risk factors. And so I started sharing that. And quite honestly, I got 2 phone calls from 2 girls I went to high school with. I haven't spoken to them in years.
Wow.
Who's your gynecologist? Can I have your gynecologist's number? I haven't been to the doctor in years.
Wow.
You woke me up.
Oh, you woke me up is so powerful.
Yeah.
Yeah.
I was so excited. That was 2 people.
Yeah.
And then I was finding that, I wasn't finding any groups for endometrial cancer. There's lots of support groups for breast cancer. There's lots of support groups for colon cancer. Nothing for endometrial cancer. Since the TikTok, I have people coming on and say, I too have the same cancer. I too am going through you. I have a lady who's like right behind me in the stage. And I was on chemo 5. She was on chemo 4 the same day and everything. Wow. And so we've been sharing things. Like, I share what I did to help myself feel better, or she shared something like, this is a good food to eat. Or just the other day, I had a new person join in, and she said, I just had my hysterectomy yesterday. And watching your TikToks has helped me with the beginning of my journey. So I was like, wow. And when I got up to 75 followers, I was like, so excited.
Yeah.
And I was like, wow, 75 people are actually listening to me. And then the next thing I know, my daughter's like, Mom, you have 1,000 followers.
Yeah.
And I was like, you have to be kidding me. She was like, no. And I was like, I'm making a difference. I'm helping somebody, and so that's what makes me feel good. And even when I have bad days, I'll go on TikTok and say, today's not a good day.
Yeah.
But they need to know the truth. This is what you're going to go through if you're dealing with this. So I try to share the truth.
I love that. I think when I think about what, hope is, I think it is like, it's a thread of evidence that what happened for the person before can happen for me. It gives me hope that I can live better, do better, be better when I see someone else sharing their story and experience. And I think that it's so important that we understand that hope is not always stemmed from the highs. It's also from seeing people rise from lows. And if people don't know that you need the help or that the help is available, they don't understand how to offer hope to you. So I love that you don't, as much as you're feeding others, you're being so fed by this experience. It is very cyclical for you. It's returning the joy, the hope you need, and you're also feeding out hope. So community does that. When you are, you mentioned earlier, getting rid of toxic people in your life because they truly can poison the fruit, the soil, right? And so,
Yeah.
but great community can enrich your life. It makes life longer. It makes it worthwhile, and it offers vitality. I really want to know from both of you. I'll start with you, Dr. Moore. What have you seen? And in this world, we call every friend a great girlfriend because these are the people that supercharge and inject joy and oxygen and hydration to your life experiences. So I want to know, Dr. Moore, in terms of patience and experience, how valuable, how important is it for women to have great girlfriends in their corner, to help them journey through their stages of treatment?
I think that's a great question. I think it is one of the key essentials to survivorship. I think
Wow.
it is.
Yeah.
My sister has cancer. She doesn't have endometrial cancer, but she has lymphoma. And she was diagnosed probably 4 years ago. And I'm her champion. I'm her girlfriend. I'm the person she's calling with all of these questions about life, not about cancer, but just about life. What do you think is going to happen? Do you think I'm going to have children? Do you think I'll still be able to get married? Do you think I'll live long? But I help encourage her. So I know what it is, both personally in my personal life, to serve as a girlfriend to my sister, but even for patients. Patients need that girlfriend. And that girlfriend doesn't necessarily have to be a girl. It can be a father. It can be your son. It can be someone you work with and one of your coworkers. But you need that person that you can call at any time of the day and that they're there for you. That person that'll accompany you to your appointments when you are scared out of your mind. But that person is your sense of calm. So I'm that for my sister, and my patients have people that serve as their girlfriend. So I think it's critical to survivorship.
Wow, I love that. Thank you so much for that, Dr. Moore. Stacey, what has that done for you, having great girlfriends in your corner?
Uh, Unfortunately, I think my cancer has scared off some of my girlfriends. They're not quite sure what to say or what to ask.
Mm.
I get a phone call, every 3-4 weeks or something like that. I do have one girlfriend. She calls me every day, and I love it because we never talk about cancer. We never talk about cancer. We talk
Yeah.
about what girlfriends talk about.
Yeah.
But my sister has been my great girlfriend. She has been there. She has been to all but one chemo, and that's my daughter went to that one. My daughter lives out of the country, so she couldn't. I refused to let her come in, and said, "Nope, you finish up your schooling, and then you can come see mom." But my sister's been to pretty much all the appointments. She's been my rock. My partner, I even think that of 11 years has that relationship, the cancer kind of, I think, scared him away. I really don't know. It's a scary thing to a lot of people because they hear that word and they automatically assume that, oh my gosh, she's terminal. She's going to die on me. And people are afraid. And so I put a lot on my sister, but she's my sister. That's what she's there for. She's my older sister. It's just her and I. Our parents are deceased. And she's been there, and she's been the one asking all the questions. When I can't think of things to ask the doctor, she's right there. She's right there with all the questions and things that I'm afraid to ask the doctor. She's not. So she has really, really, really been good to me. And I had a friend who had a critical illness, an old friend from college who kind of just stepped in when my relationship and just helped me to understand what critical illnesses do to relationships. And he would just go, you know what? Let's go for mocktails since we can't have anything to drink right now, and let's just talk how you feeling. And we would talk about like forgiving people because they just don't know. He would tell me, you need to forgive. They don't know how to deal with this. So he really, really, really helped me through. I lost him in July. He passed away. So that was really hard because when I was feeling down, all I had to do was pick up my telephone. So that was hard. But then my sister was like, but look what you had with him those last few months of his life, dealing with that critical illness. And I was like, yeah, that was something special. So I take that with me.
Yeah. I hope and pray. I mean, I'm really grateful that you have your sister. You have the friend that's picking up every day, and then you'll also have a new village of people as you continue to journey and continue to share and continue to connect. That'll help create the healing heart, give you the space to heal through those exits are not easy, right? They hurt, and especially at this time. And they're not because you're not amazing. They're because this is not the time for those people to occupy that space. And that the right people are coming to occupy the spaces that need to be occupied. But in the meantime, your sister's spreading her wings wide, and she's like, I'm going to make sure I set the standard for quality. I'm going to get my sister to the other side of this. We're going to make it through. And she's showing you that, a great girlfriend can also be a sister, and a sister can be a great girlfriend, like vice versa. And I am grateful for that. I understand that painful part of those exits. And then sometimes I'm like, wow, thank you that they exited. Because how much harder would my life have become if they were not playing their part in the right way when I needed them to be, in position, And so I hope that encourages you, Stacey. And I hope that, because you're so bright. Like, you're just bright.
I appreciate that.
Light and so much to give, and you're just contributing in so many powerful ways. And the work that you're doing, I just want to celebrate that because, again, the storytelling, you making space for other people to journey with you and giving, bringing life and awareness to your story is saving so many lives, not just the two that called, but the others that are taking notes, that are doing a little Google search, that are starting to become curious, that are looking at symptoms, that are knowing that a rough day doesn't mean the last day. All these things, these are all breadcrumbs of life that you're offering to other people. And, Dr. Moore, your advocacy, and even understanding and just use of the word equity and the push for equity is going to be a driving force for more inclusive conversations across all tables, right? So that at every level, there's room for us to be seen, to be included, respected, represented. So I want to thank you because I understand that is not easy work. Activism is not easy, but it is essential for equity to be a conversation and to be something that we can pursue. Many moons ago, actually, at a Healthy Woman event, a doctor talked about the difference between equality and equity and the game changer that equity makes for us to have the means to make different choices. Yeah. So, I really am grateful that you're advocating, at such a high level for equity for women of color.
Absolutely. Yeah. I know that'll be my life's work that'll continue, and I hope somebody else behind me will continue it because I think it's lifelong. It's a marathon that doesn't end.
Yes. So for the great girlfriends that are listening, I just want to encourage every single one of you. If you or anyone you know, a great girlfriend, neighbor, cousin, coworker, family member, woman you might meet in the grocery store, you just never know. Any woman that you know may be experiencing symptoms or signs of endometrial cancer or any form of cancer. Healthywomen.org has extraordinary resources that have been made available by Eisai. And I want to make sure that we are plugging into those resources, asking questions, and sharing those resources. The more we read, the more we share, the more we save lives, right? There's more survivorship in that connection. And I want to thank you, Stacey, and thank you, Dr. Moore, for being on today. You both have been wonderful guests and have given me so much. I've learned so much just listening to both of you. And I know that every woman that's listening will also take away so many powerful nuggets. So thank you for being here.
All right, great girlfriends, did you enjoy this week's episode of the podcast? If so, would you please give us your amazing review on iTunes? Every single review helps another great girlfriend get plugged into the podcast and the community. Speaking of community, make sure you join our Facebook group at The Great Girlfriends, follow us on Instagram at The Great Girlfriends, and on Twitter at @the_great GFS. I'm Sibylla Muti, and I'm out. Peace.